Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend Colin Hung. The world of technology and healthcare, ever changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news, meshed together in new ways which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. And today we're going to be doing a recap of the ViVE and HIMSS conferences. And be sure to follow the show on social media at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 19 years of health IT content at healthcareittoday.com. How many ViVEs and HIMSS have we been to? A lot.
Well, ViVE, yeah, every one of ViVE
Every
because it's
ViVE,
new.
that's true. Yeah, okay.
But for HIMSS, I think this was my 17th or 18th. I can't, like, it's hard to remember them all.
Yeah, I'll lose track. I think it's 16 for me. I don't know.
I mean, we've been there since before the meaningful use days, right? Like that's how long we've been going. I think that between the two of us.
Yeah,
My
mine was
first
right
one,
at the start of meaningful use. Like we just heard about government money and we were going to HIMSS. So
nice. Nice. Yeah, there were a few there in the early days I missed. I went to one and then I didn't go back for a couple of years because we're
okay.
trying to get budget. But anyway, yeah, it's been a long time. But still amazed at running into people who've been there like 20 plus, right? Like just blows my mind.
Yeah, we're doing some work with Steve Lieber and hearing them talk about some of the early days and or even Ivo Nelson. I've talked to him before and he's like, John, you don't understand. It used to be 1,000 of us, it used to be a few hundred of us in a room, trying to say, how should we use technology? But we've come a long way since then.
That's awesome. That's awesome. So John, let me ask you this question. What was your main takeaway for health IT in general coming out of ViVE and HIMSS?
The big takeaway is AI everything. So I don't know a company that's not doing AI. So I think AI is being applied in so many different ways. The only exception might be a few data companies, but even them, they're saying, hey, we're making the AI work, because we're cleaning up the data, we're making the data usable, things like that. So yeah, AI has definitely overwhelmed it. And I did hear an interesting insight from Stephanie Lahr from Artisite, and I agreed with her completely. She's like, there's a lot more creativity, a lot more, exciting announcements and progress on different products from a wide variety of companies, including incumbents and startups and everyone. Whereas before, you kind of like, I know that company. That company does XYZ, right? And he's like, yeah, they've done XYZ and they're gonna do XYZ, and like they'll do it forever. But now, and I think it is because of the AI, these companies are saying, hey, we have an opportunity to do something new and interesting that maybe before wasn't possible. So, I love that insight from Stephanie. And I agree completely that we've seen more creativity and pushing the ball forward from a lot of companies than we've seen in previous years.
Yeah, I mean, it's hard to disagree with you. I mean, I don't think any of us expected that AI wouldn't be the top topic coming out of both those conferences. It was certainly everywhere in the exhibit halls, right? Like every company had AI something. I think unlike prior years, though, for me, the AI talk got more practical, more realistic this year. It wasn't just sort of like, hey, we're going to solve all of healthcare problems. It was much more like we're going to solve this very specific problem, or we're going to reduce this very specific administrative burden, or a clinical assistance. So I think that was encouraging, and it definitely led to a lot more innovative use of the technology, right? It wasn't all just generating better patient engagement text, right? It was around, hey, like we can actually help pre-fill a form, but be contextually aware of where that form was being activated from and draw in data from multiple places. I mean, that was something that the folks over at Notable were talking about at HIMSS, so with their client, which was MIT Health. So, that was kind of interesting just to see those kinds of use cases start popping up. And that was sort of the biggest difference in AI for me at the two shows.
Yeah, the other interesting thing is there's this kind of opposite feeling from many of the CIOs and leaders in health IT where they're like, we actually want fewer apps, right? Like that's the feeling that they have. So app rationalization has become a really big thing where they said, why do we have 300 or 1,000 or whatever applications? Like, can we get that number down? And what's interesting is, okay, that, what does that say about AI? Well, then they're probably going to take AI from the companies they're already working with. That's one message. The second one is if you're an AI company trying to bolt on, a new application, that's a big uphill battle. You better have a compelling use case. But we are in this funky middle ground, this messy middle where there's not an all-in-one AI platform that can do everything that you need across radiology, operations, RCM, clinical, et cetera, and it's just like, hey, this is all the AI you need. And I don't know if we'll ever get there. Maybe we'll get one for radiology, one for clinical, one for RCM or something like that. But like we don't have that. Right now we have a bunch of best of breed, specific solutions, kind of to what you were saying, where they're like, hey, we can solve your low balance problem on our, RCM. But that goes against though what most leaders want to do, which is fewer vendors, fewer applications, but they don't really have a choice right now because there's no like all-in-one AI vendor.
Actually, that was the exact point of the discussion I had with Nikhil from Ambience when I was with him at ViVE. I asked him that very question: Are we heading for a single AI player world down the road, or are we heading for best of breed? And his answer I thought was pretty funny. Like he basically said what you're saying now, which is for a while, the next few years, it's going to be best of breed because the application of AI is still so new and it's still being kind of figured out. Like, what can I actually use the same AI engine for radiology versus oncology versus communicating with a patient? Right now, it doesn't seem likely, but that will change as AI gets better, right? As the algorithms improve, as data improves. So he, and I agree with him, over time, believes that we'll go back to, you know what, you may not have as many AI algorithms running. You may have one for clinical, you may have one for communication, and you may have one for infrastructure, right? That kind of thing. So, but for right now, I think you're right, John. I think CIOs and IT departments need to be prepared for a best in breed approach, at least when it comes to AI for now.
Yeah. The other topic that really was big was security. It's
Mm.
still hot and trending and is a problem and a challenge for many organizations. I ran across a lot of security companies. It was amazing how many security companies from outside of healthcare saw an opportunity in healthcare. But then there's some that know healthcare really well. Done a lot of work with Proofpoint, and they have very specific healthcare applications and customers advisory board, et cetera, to be able to customize their solutions to healthcare. Zscaler is doing some really interesting things with zero trust. They released a couple books that I think, kind of demystify the leadership and the technical aspects of it. So I thought that was really interesting. So I think we are seeing a maturing of the security landscape, where healthcare organizations have the budget, can buy the right solutions, but also the realization that, hey, the problem is social engineering. So what are we going to do about that? Obviously that's why Proofpoint is so good, is because they are identifying who are the people most at risk. Is it coming in through your email, through some sort of phishing, those types of solutions. So it's going to be interesting to see how the security evolves, but it's still a hot topic.
Was there any company, John, at ViVE or HIMSS that stood out to you at the event?
Yeah, so many. And I think, between ViVE and HIMSS, you get this wave of announcements. Some of them we saw coming, one that, we probably should have seen coming is Epic saying that they're going to do ERP. I'm not sure that's really true in the sense of like a full ERP. I think it's going to be an ERP for people who can't afford an ERP. But we'll see how that evolves over time. They could develop eventually to become a full ERP. Another one that stood out for me was Harmony Health IT. They announced an AI for clinical data abstraction. So being able to pull the data, in a very quick way in granular form. I thought that was a powerful thing. LK talking about all their data management. Congrats to Ajay, who became the CEO of LK. That was kind of exciting for them. I know I love the best response was, wait, he wasn't CEO already. He's been kind of in the face of LK for a while. So, but it's amazing how deep they are into the data management for many provider organizations, and I heard that from a lot of people.
Yeah, lots. I love that LK announcement, by the way. I think we've known Ajay for a while, and yeah, he's definitely been the face of that company. There were lots of great announcements. The one that really stood out for me and caused a big stir, at least in terms of audience interest, was the Microsoft announcement of their new Dragon application for, for docs. Just walking by the Microsoft booth at HIMSS, there was always a lineup. Like I'm talking like 10, 20 people deep to go into the model office, physician's office that they had there to actually try it. And everyone that I sort of casually spoke to on the other side as they came out was just like, wow, it's impressive. Like it really does do exactly what you think it should be doing. So I mean, kudos to them. It was a very innocuous sort of product announcement. I thought when I first read it, but clearly it struck a chord because everyone in the lineup was either a clinician or a CIO representing clinicians, and they're like, "I got to go try this." That was to me was probably the biggest standout in terms of announcements from a product perspective that I saw.
Yeah, my question is, are they biting off too much, right? And will they kind of fall short on the ambient voice stuff, the medical scribe that we like? It'll be interesting to see how they evolve that. That's what that announcement, man, they went big, they went well beyond just kind of the AI medical scribe stuff to many other things. And the line was too long. I never made it in to see it actually. So, I'm interested to learn more and see how it's going to evolve. We certainly saw Nabla, Suki, Abridge. You mentioned Ambience, Healthcare, Deep Scribe, IKS Health. They were all had a big presence there, and a lot of people wanting to talk about AI medical scribes. So, there's no surprise there that that's such a big one. One that was interesting was Heidi Health. I think they're originally out of Australia, but they had a party with Anthropic, which it's
Hmm.
interesting that they are leveraging Anthropic. They leverage a number of different tools, but to be so deeply integrated with Anthropic was pretty interesting.
Yeah, I mean, and one announcement also a little bit self-serving, but that came out during ViVE was Clinical Architecture unveiled their PIQI, or I don't know, PIQI, I guess it's called, framework for gauging data integrity and data quality inside a database. And this came actually from a conversation that Charlie and I had way back when, where I just made an offhand comment to him about why can't we just sort of plug something into a database and have it tell us how good the data is inside it, and then that way we would know whether or not you need to do something with it, improve it or normalize it or do whatever. And during a presentation, apparently he mentioned that conversation and said that was part of the inspiration to create this new product of theirs and this new approach of theirs. So
That's
pretty
awesome.
happy about that. Well, pretty excited for them though, because it is needed, right? Like we talk about data quality, but there's no measure. Like how do you know your data is good or bad or not? So Charlie and team over at Clinical Architecture have come up with a framework for that.
Yeah, Atropos Healthcare or Atropos Health, I think is officially their name. They have a data quality score, but theirs is a little slightly different, which is that data relevant data to answer the question that you're asking? And so they
Mm.
create a score for how good the data is at answering the actual question, which I think this is the future, is understanding how good is the data, how good is the data at answering specific questions. So that was fascinating. Rhapsody has
Yeah.
been doing a lot with data and exchanging data. I was really impressed with their AI EMPI. They've used algorithms for a while, and leveraging machine learning to improve EMPI is a powerful thing. It has great impact for users. It prevents a safety risk of patient not getting the right data to the right doctor for the care, and it also prevents a HIPAA violation of the wrong data being on the wrong patient. So I think that's cool. Another one that was interesting was ECW. They had a really big booth, and it was divided into kind of 3 areas. One was their EHR, of course, the ECW eClinicalWorks EHR. But then they also had Suno AI, which is their ambient voice AI medical scribe solution. And then they had the Hilo Genie call center AI agent. So it's interesting to see ECW getting into like other products that aren't necessarily, certainly they're going to serve ECW customers, but it could go well beyond ECW customers. I thought that was an interesting, move on their part.
Yeah. No, and ECW, it was funny because ECW was located what I called EHR corner, because if you stood at this one spot, in every corner there was an EHR company. It was Epic, Oracle, ECW, and Athena in one corner.
They had big boosts. That was for sure.
That was pretty funny. I don't know if they did that on purpose, but it was certainly fun to see that. Hey, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and Colin Hung. Today, we're looking back at the recent ViVE and HIMSS conferences. So, John, what's your overall feeling about these large events?
Yeah, I think HIMSS was interesting because it kind of, and I think you and I both had the same reaction, which is like, it feels like it's back, like the energy was there, the number of people, the hallways were full, the energy in the exhibit hall was good, like it was interesting. It felt like it was back. I do think there was an overarching thing that was like, hey, I can't do both. There, vendors were, so some vendors were doing both depending on who their target audience was. But from attendees, they were like, I need to go to one or the other. And so people are kind of doing that dividing line and saying, should I go to ViVE or should I go to HIMSS? But I probably can't do both. So, I actually think people like the large events. They can meet a lot of vendors all in one place. They can meet a lot of partners. They can meet a lot of peers in one place. So I think that is probably going to continue and will still be successful for them. But I do think people are kind of like, hey, ViVE and HIMSS are too close and I can't do both. That doesn't make sense for my organization. Doesn't make sense for all the work I have to do. So I think we are seeing a bit of a choosing between the two conferences.
Yeah, I would agree. Certainly I think HIMSS felt more crowded than it ever has. And obviously that's not a function of the space because it's been there for a while. It's been there a few times in Vegas there. So the hallways were crowded, the aisleways were crowded. So it felt more like a HIMSS. Um, the funny thing is that the not funny thing, but the booths were smaller the overall. So there were just as many vendors, but each of them were smaller like in size. And so they didn't have the downstairs like they typically do, where they, have like the hall spill over into the downstairs, and they had the keynote in that separated room. So that physically the exhibit hall was actually smaller. Um, but the energy was still there, right? People are still excited. And I did talk to people, and they all seemed to say they had some pretty good meetings. Not a lot, but they had some really good discussions with people at him. So that was kind of nice to hear. I agree with you. I think there's a lot of burnout of trying to go to both. And I think a lot of people are going to be choosing one or the other next year for sure, since they are so close again. But I'm also getting the sense that there's now starting to be some differentiation between the two, right? Like I think HIMSS continues to be the place where you buy enterprise stuff, right? Like if you're looking for a solution and you have a problem to solve, I feel that HIMSS is still the place where most people go and do that. ViVE to me is really more now getting into because the CIOs are there. It's a little bit more future looking, if you will, and a bit more around like innovation and new solutions. Because the booths are smaller, you have a lot more of the startup type stuff happening at that show and at that conference. So it's subtle, but I think there's starting to be some separation in terms of why you might go to one versus the other. The two aren't the same.
Yeah, and to your point, I think a truth that we've known in the Sway Health community, our marketing community, for a long time is that hey, when you're at a big conference like that, the work you do before the conference is going to determine how successful the conference is for you. So those companies that understood that and told their salespeople, you need 10 meetings, make it happen, and this is the place where they are, and it's an opportunity, but we need to make the most of it. Those ones were really successful, and we see that from a lot of companies. that, they're able to have all those meetings in one place and in a quick and efficient fashion. So I think that's a kind of a universal rule for sure. We are seeing interesting differentiation. Content wise, I'm not sure it was that different, to be frank. There were maybe a few bigger name celebrities at ViVE, because that's kind of how they approach stuff. Although people, loved having Simone Biles at HIMSS. That was a standout for a lot of people I saw. What's interesting though is it felt like at ViVE, the speaking sessions, there were fewer chairs and maybe even fewer people attending them. And maybe, I don't know if ViVE did that on purpose, or they're just embracing the fact that many CIOs just want to connect with each other, not go to the sessions. I'm not sure, but that felt like it. And maybe it was just the space. Nashville was smaller and they didn't have room to put more chairs. So, I think it will be interesting to see how that evolves as well.
Yeah, no, I think it's true. I mean, I've often wondered, will Vive or Hims become more like with JP Morgan, where it's actually, in theory, you could go to the city where either of those two conferences are being held and just meet with people. Like you don't, not that I would encourage this, but you don't have to go inside the conference, right? Like kind of like JP Morgan, like most people who go to that conference aren't actually going to the conference. They're just going to the area because all the people that they need to meet with are there. And I wonder if that's going to start to become more prevalent, right? Where, hey, like all the vendors I need to see are there. Well, maybe I won't go to HIMSS. I'll just go and meet them all, right? Or vice versa. If you're the executive of a vendor, you may just go to HIMSS or ViVE just to meet with some of the people you need to meet with. To your point, though, I think um, a lot of the sessions I found, at least in terms at ViVE, were topics that had been seen before. Like, there wasn't a lot of really new stuff. There were a few, don't get me wrong, new takes maybe on an old topic, but I think that's maybe why they weren't as popular, because we've heard it. The AI sort of hype is flattened a little bit, so we don't need to hear any more about just plain old AI. I want to hear about something more specific. So the theaters though that were inside vendor booths, those seemed very full, and that was a trend that I saw at HIMSS especially, where the stuff very specific to, well, here's how we've applied the AI with our solution. Those theater sessions actually were quite full.
Yeah, I mean, even the sessions in the booths, we did one with Dell Technologies. We had a good group that came by, and a lot of great people listening in. So, I think that was interesting. It's interesting when you talk about people doing kind of the JP Morgan style. ViVE was really cracking down on sharing badges and stuff, and appropriately so. You shouldn't be at the conference if you're not. If you haven't paid and you don't have a badge. So, I think that is problematic. I wish they would offer some more variety, some single day badges or things like that, which I don't think they offer. HIMSS does, so that it's a little more flexible that way. They give out more exhibitor badges, I think, too. And so it's interesting. That might be one solution, right? It reminds me of streaming services. We all would download stuff illegally because we couldn't find a way to pay for it, right? Or at least without paying through the nose for some massive subscription. It's kind of the same problem. People want to just pay for the one day, and if they don't have that option, then they're like, well, I don't want to pay for the entire conference if I'm only there half day or something like that. So anyway, we'll see how that evolves for sure. Were there any booths or sessions, parties that stood out for you at any of these events?
Well, again, at the risk of being a little too self-serving, I did do two videos that are out there on the Sway Health YouTube channel for Best in Show for ViVE and Best in Show for HIMSS, where I do talk about the best booths and the giveaways that stood out to me. So I would encourage you to go over there to find out which ones I chose. But I will say about the parties, since I didn't talk about those on those videos. Um, I think the trend of multiple organizations getting together to put on a party is now a permanent fixture. I mean, I thought it was a trend. I thought maybe it would end, but it's clearly something that people are willing to, and I think it's great. Why not bring 4 or 5 companies together and merge their clients together in a bigger room, in a bigger venue, have a better party? And one of the things that I really enjoyed this year was um, the fact that so first, well, the one party that stood out for me was the LK party. right? So the LK party was that I went to, was at Flight in this was at HIMSS in Las Vegas, and A, the food was great. B, they had enough LK people there, but not overwhelmingly so many, right? Where it was just clearly a sales thing. But either they went through really good training or they're just like that. But they were really truly engaging with people. I noticed a few times where if there was somebody sitting by themselves, an LK person would walk over and introduce themselves, say hello. Like they were really truly all acting as hosts. And I think that to me, that's what stood out. It's a really weird thing to stand out, but I just noticed that there at that party, and I thought that was great.
Yeah, LK does do a good job of that. And it's sad for you because actually the LK party at ViVE was even better than the one at HIMSS. And actually I think that's true for most parties. Nashville is a better party spot than Vegas, which I'm sad to say as a Vegas local. Like the Venetian's nice because it's easy access to lots of different venues for parties. So I like that in some ways better than Orlando when HIMSS goes there. But Nashville, I mean, the number of locations that are close there on Broadway that people could do and that they rented out, had live music, had bands, had fun, had good food. Like there were better parties at ViVE than there were at HIMSS. I think that, when I look at the parties schedule, Nashville wins there. There were a lot of great ones, including the ViVE opening party up at the balcony overlooking the street. That was awesome. There was an indoor outdoor one, which it was snowing, so that was kind of interesting in Nashville. But yeah, there were a lot of good parties and connections. I really liked the Mediquant one too. They brought back a bunch of Encore Health Resources people. I got to see some old friends there, and that was pretty cool that they were kind of honoring kind of a previous company. I thought that was cool. The winner in Las Vegas was definitely Flight Club, the dart place. That was the number one venue for people to be able to do parties. I think there were so many parties. You could just go there. There were like 4 parties all happening in that place. So it's like you were guaranteed to find it. And credit to Meditech. Meditech found a place I'd never been to, which is amazing because I think I've been to 100 conferences at the Venetian. They found this kind of speakeasy almost style club, and everyone was dressed up, and they had their customers there. They did a good job on that party. So credit them for finding a great locale and bringing together a lot of good people. And then I'll throw one more out there. Rhapsody. Rhapsody had the highest quality of like really interesting people, especially in the interoperability space. That party was awesome, and by the quality of attendee was awesome.
That's great. And you're right about Flight there, John. It was definitely the most popular place to have a party. I will just mention one last thing before we have to wrap up. We're at close to the time, but I will say that there was a couple of sessions that really surprised me. I went to one inside the Meditech booth. You mentioned Meditech. They had a Canadian organization there, the Rehab Hospital in Toronto, Holland Bloorview. They were talking about interoperability, but the one takeaway I had from that one was the interoperability was benefiting the organization. It was in addition to benefiting patients. And I thought that was a great reframe and perhaps a way to drive interoperability more forward. And then there was a great LK session that I went to where Ajay was just being the moderator up on the main stage, where if you listened carefully, these two organizations, two provider organizations, were dropping big hints about what types of vendors they were going to be looking for down the road and what vendors would have to do in order to do business with them. I thought that was really, really really, really interesting. I'm going to probably be publishing a summary of that one so you can read what those were, but I thought those were really cool as well.
Awesome.
Hey, listen, thanks to all of you who tuned into this episode of Healthcare IT Today. You can find more details about our show by checking out the programs page at healthcarenowradio.com. And please engage with the community and on social media using the hashtag HITSM and at our website, healthcareittoday.com. I'm Colin Hung with my health IT collaborator, John Lin. Thanks for watching, and we'll catch you on the next one.